Welcome back. Are we ready or not? That's the question, and it's the title of a new report out about how prepared our country and our state is for the next big disaster or challenge. Joining me this morning to break down how Connecticut fares is Dara Lieberman. She's Director of Government Relations for Trust for America's Health, the organization behind the report. Dara, thank you for being with us. I guess let's start with the key findings. Where do we stand overall?
Well, we've been doing a version of this report for over 20 years, and we found a lot of progress in our preparedness for public health emergencies over that time. But we also find that every state and the nation at large has a ways to go before we feel more ready for the next disaster.
Obviously, I want to talk about Connecticut, and we'll get to that in just a moment. But let's first talk about what we're talking about. So what kinds of things is this report looking at? What kinds of disasters, what kinds of situations would you be talking about the preparedness for?
Well, we're really talking about the health impacts of disasters ranging from infectious disease outbreaks to train derailments to wildfires to extreme heat and man-made events. We know that all of these have physical, mental, and broader health concerns for individuals and communities. So we argue for preparing for all types of emergencies because we really don't know what's coming next.
How do you do that evaluation? What are the factors that you look at as you go from state to state or around the country to determine? You listed all those, those terrible things that could happen to any community. And I think we've all seen those in the headlines, whether it was in our community or around the country. But what factors do you then look at to evaluate the preparedness?
Well, we work with experts and gather data on 9 key indicators of state preparedness. And they're intended not to be the total picture of a state's readiness for disasters, but really to tell policymakers at the state level what actions they could take to be a little more ready. And we're showing that it's not up to just one sector. It's really up to policymakers, public health officials, the healthcare system, and the community at large.
So let's talk about Connecticut, if you would. What were your findings related to our state? A lot of our viewers are going to be interested to hear how ready their state is.
Well, we tier states into high, middle, and lower tier according to our indicators, and Connecticut was in the high tier again this year, as they were last year. So there's some areas of real strength in the way we gather data. For example, Connecticut's 4th in the nation for vaccinating its population against seasonal flu last year, which is so important, not just to make sure that our hospitals aren't overrun with flu patients every winter, but to make sure that we're ready for an infectious disease outbreak that may require more of the population to be vaccinated.
Other notable things about Connecticut, anything else that jumped out at you in our results, maybe compared to surrounding states or compared to some other parts of the country?
Well, one really important indicator is the state's commitment to public health funding. Now, federal funding is super important when it comes to public health, but the state has also increased its public health budgets for the last couple of years. And that's so important because, as you know, we can't build a firehouse after a fire's already broken out. But at the same time, we tend to only fund public health after there's an emergency. So having that money, the people, the systems, the laboratories in place ahead of time, that makes the state and the nation much more prepared.
As I was looking at some of the factors you were considering and some of the types of events, one thing that got my attention was extreme weather being one of the key things you're looking at. You talk about doing the report over 20 years. Has the importance or the rank of extreme weather risen on that report?
Well, certainly we're seeing disasters more frequent and more extreme. This year, we focused on extreme heat because in 2022, of all natural disasters, more people died from extreme heat than any other kind of disaster in our country. So we know it's not just Arizona, it's not just the southern and southwest states that need to be prepared, but northern states are seeing longer periods of extreme heat. So we argue that localities need to have heat action plans in place. They need to know where people are that are most at risk, like older adults, like young children, and work with community partners to make sure those people are able to access cooling centers and other resources.
And I know one thing the report talks about is health equity. And if you're talking about particularly something like extreme heat, I would imagine that perhaps even within a high readiness state like Connecticut, there may be pockets where people are getting different levels of care, of support. Is that something that the report looks at?
Sure, of course, people who work outside are extremely vulnerable during extreme heat. Think about, an older adult who's low income may have an air conditioner but not be able to afford to run it. So planning for people who are historically underreached or under-resourced, that needs to be a focus in those heat action plans as well.
All right, just one last thing. Tell us what the recommendations are. I know one part of this long-term study is to make recommendations. So you mentioned Connecticut being in the high sector, which I think our viewers probably will be pleased to hear, but there must still be things that we could do better and that as a nation, other states could do better. What are the recommendations?
Well, at the Connecticut level, certainly maintaining that public health funding is so important. The state could join the Nurse Licensure Compact, which is a way that nurses can practice across state lines, particularly important when there's a workforce surge during an emergency. At the federal level, the number one most important thing is to make sure we are funding CDC and public health, because most of that money goes out to states to really build that foundation for readiness for all kinds of emergencies.
All right, Dara Lieberman, Director of Government Relations at the Trust for America's Health. People can check out that report if they want to find more, but we appreciate you joining us to sum it up. Thanks for being here on
Thank
CT24.
you so much.
All right.
I appreciate your time. Thank you.